Hello, Nantucket. I'm Roberto Santamaria, the Health Department Director for the island of Nantucket. Since there was no select board meeting this week, I would like to present our report that I would normally give on Wednesdays regarding our COVID-19 outbreak. First off, this week, as of today, we've had 9,448 tests. Of that, 3,193 tests were the CASNet testing for asymptomatic testing. That number has kind of dropped off over the past few weeks, so now we're only regularly testing around 25 to 40 CASNet people every day on average. So today we're seeing a spike in cases over the past few days. So in the last 10 days, we had 35, 63 in 20 days, and 80 in the last 30 days. September was not a good month for us. More than half of all our cases were done in the month of September. However, it is good to note that not all cases are symptomatic. However, it is important to understand, though, that just because you're not showing symptoms doesn't mean you're not contagious. And also, a person who is asymptomatic, just because you're not showing symptoms, doesn't mean it was a false positive either. Always treat your positive test as if you were infected with COVID, even if you're not showing symptoms. It is important for that because most of these cases that we've been seeing in the last 30 days have been spread through asymptomatic spread. So where do we stand on our metrics? You know, our typical stoplight measures, we have 2 yellows right now. So what does it mean? The first yellow is this COVID positivity rate. Positivity rate just a few weeks ago at the last select board meeting was only 1%. Now it's at 5.88%. We're getting dangerously close to that 10%, which means rollback or shutdown. Nobody wants to see a shutdown, and we're not looking to shut anything down as of right now. We just need to understand that if our positivity rate keeps going up, we may need to increase the amount of restrictions. And you'll see that we did have 2 patients transferred over the last few days, and it is really important. Those are cases that we really hope get better, and we pray for their recovery. So where are we with our metrics? So far, we are seeing that the age breakdown is now kind of shifting a bit. You'll see that the under 20 has increased. That's because we have seen a fair amount of children become positive with COVID. None of them are in the schools as far as we know, to our knowledge. However, it is important to understand that that is where these numbers are coming from. It is an even 50-50 split among male and females. But again, more than 50% of all our cases are below the age of 40. The race breakdown has shifted significantly. Please compare this metric to the select board meeting from September 15th to get the 2 comparison. But you'll see that we have had shifts in the numbers, especially in our non-Hispanic origin group. Point of origin, almost all of our recent cases have been from Nantucket. Only a few were imported from elsewhere. And you'll see here in the month of September, this area that I have highlighted on the graph, originally we had gone from a first step and then we had evened out. We had essentially stopped that first wave. And then now we're in the midst of a second wave. You'll see that the slope of these 2 kind of mirror each other, and they're both going up at around the same rate. And as far as the sewer goes, if we're paying attention, you'll see that this is actually from a few days ago. This was September 28th. It's important to note that this is a predictive index. So we're going to see between 1 and 5 cases every day or so over the next 7 days. That's why it's important to pay attention to the mitigation measures that we have asked. Wear a mask anytime you leave the house. We've asked to flatten the curves. We had done very well, and we have dropped it down to just a few days ago to less than 5 cases, and less than 1 case a day. But now we're up to, again, an average of 5 cases, and there is no sign of this curve slowing down. So we really need your help. And then the R value. R value is our last metric. And the R value means if the virus is going to spread or propagate in our community. And what you see down here on the bottom right is that the R value right now is a 1.57, which means that for every person that is sick, a little more than one other person gets sick. So sometimes if I were to be sick, I can infect one or two other people on average, is what you're seeing. So our next steps here is that the Board of Health is looking to possibly meet next week, and we'll be discussing emergency orders if these cases do not slow down. It takes the entire community. We need your help to get out of the red zone. So let's all work together, wearing our masks, washing our hands, and maintaining social distancing. And we know it's tough, but we can do this together to get out of the red zone. If you have any questions, please feel free to contact the health department at health@nantucket-ma.gov. I'm Roberto Santamaria, your health director for Nantucket. Thank you.